First human case of West Nile virus has been confirmed in Massachusetts. Here to answer questions is Dr. Ali Raja, Deputy Chair of the Department of Emergency Medicine at Mass General Hospital. Dr. Raja, thank you so much for joining us.
Thanks, Jen.
All right, so the West Nile virus, Dr. Raja, as you know, is spread by mosquitoes. Bites are common, of course, but what about the illness? We do hear about it usually every year around this time.
You're right, Ben. We hear about it every now and then, but it's not very common. Last year, a total of 11 people throughout the state got it, so it's pretty rare. And the main thing you can do is actually the same thing, or to prevent it, is the same thing you do to prevent mosquito bites. So use repellent, wear long sleeves and pants, and get rid of any standing water you have outside your house.
Well, state health officials say the patient is a woman in her 70s. They're not releasing any information about her symptoms or how she's doing right now. But in your experience, is this illness difficult to identify, first of all, and then to treat?
It can be, Jen. And the fact is that it can incubate for a little while. It can incubate for 2 days up to a couple of weeks after the bite. And 4 in 5 cases actually don't develop symptoms at all. Fortunately, if symptoms do develop, the vast majority of the time, there's some headaches and some muscle cramps and some bone aches. But in about 1% of patients, we can get what we call neuroinvasive disease, which is meningitis and encephalitis. And that's what we really worry about. Now, the good news is that even those patients do eventually get better, or most of them do get better, but they can be fatigued for a little while afterwards.
All right, we want to also ask you about the ongoing monkeypox outbreak. Massachusetts this week confirmed 37 new cases. It brings the statewide total to 280, at least 280 reported cases since the first one back on May 16th. What can you tell us about the infections you see there in the Mass General ER? Are they rising? Are they dropping? Are they about the same? Are they more severe? What are you seeing?
Ben, they're about the same. Now, fortunately, the cases we're seeing, it looks like it may have plateaued. And that's actually what the CDC is seeing around the country as well. When you look at the 7-day average of new cases of monkeypox around the U.S., it looks like they've plateaued over the past couple of weeks. So, there's still a lot of work to do, but it looks like the vaccinations of high-risk patients seem to be working, and the public health measures that everybody has put into place are hopefully slowing things down.
Briefly, are you concerned about children heading back to school?
Jen, briefly, it's a great question, but we don't really know yet. It's spread by close contact, and everybody knows that toddlers and little kids have a lot of close contact. But the good news is it's exceptionally rare in kids. And the CDC just put out some guidance for school nurses on their web pages that'll recommend what to do in case of a monkeypox case.
All right, Dr. Ali Raja at Mass General. Good to see you, Dr. Raja. Have a good weekend.
Thanks, Jen. Thanks, man.